Welcome to another episode of Healthcare Connections podcast, powered by Healthcare Compliance Pros. I am your host, Jeremy Winn. Our purpose for this podcast is to introduce you to key topics and experts in the healthcare industry to ensure you have what you need to successfully manage your practice. Please subscribe and follow us on our social media channels to make sure you don't miss any new episodes. If you have recommendations for guests or topics for this podcast, email me at jwin@hcp.md. With that, enjoy this episode of the Healthcare Connections podcast. Hello and welcome to another episode of the Healthcare Connections podcast. I am your host, Jeremy Winn, the Director of Sales here at Healthcare Compliance Pros. Got a really exciting guest on today. Today you're going to hear from Beth LeChance. She's the CEO and founder of Global Medical Virtual Assistants, or GMVA for short, as I've learned. But Beth, welcome to the podcast. Thank you so much for being on.
Oh, it's such a pleasure. I'm so glad you had me on. Thanks, Jeremy.
Great. Beth, why don't you give an introduction to our listeners? Tell us a little bit about yourself, your background, how you founded GMVA, and the journey to get here.
Yeah, thanks for that. So my path has not been a straight line by any means. It's been a lot of zigzagging. I went to the University of Florida thinking, oh yeah, I'm going to be a nurse or a PA. I'm going to be in the operating room. I'm going to spend my time, in the OR where I love to be. And things shifted a little bit because clinical hours were during practice hours, and I was a full scholarship athlete at the University of Florida. So I quickly then had to shift and move into a different mode, and I immediately got into the thought process of, okay, I'll go back to school once I leave college. Well, I came back to Connecticut and immediately got into pharmaceutical sales because I needed a job, right? So got into pharmaceutical sales, and I was very quickly making a lot more money than a nurse or a PA makes. So I was like, well, maybe I need to rethink this path of going back to school. So once I got into that industry, there was no turning back. And I ended up doing pharmaceutical sales for a number of years, got into surgical devices, learned a lot, and spent a lot of time in medical practices and hospitals, and really paid heavy attention to what's happening behind the scenes. In addition to that, I wanted to make sure I'm not just a sales rep showing up with donuts and pens. Like, I need to actually add value, right? So I learned how to do insurance verifications, and that's how I started doing insurance verifications to win business in some of the practices that I wanted to win their business. And so I knew how to do some of the work behind the scenes. And so what brought me to this company and the launch of this company was really, there was a need. I knew how to do a lot of the work that happens behind the scenes. I knew what impact we could make utilizing medical virtual assistants. And so I launched GMVA.
Very cool. That's awesome. Way to differentiate yourself. I mean, donuts are great. I'll never complain about somebody bringing me donuts, but when it's like, oh, you can actually impact my business as well as part of this, that's awesome. That's a really cool story. Thanks for sharing that.
Sure.
So yeah, I was excited to have you on because you're really addressing and attacking head on one of what I think is one of the biggest, and major issues in healthcare, and that's the issue around staffing and the shortage around staffing. It's an ongoing problem. You read articles daily, weekly about just how hard it is to find, recruit, retain really good, impactful employees. So let's talk about GMVA. Talk to me a little bit more. How does your service work? What are some of the tasks that your virtual assistants take on for clients?
Yeah. So how our service works is we're not an outsource. That's such an ugly word. We are truly an in-source. We bring in additional talent to service and work within the practice just remotely. So all of our medical virtual assistants are, they're doing work with that's administrative patient care, not clinical patient care, but the administrative piece around patient care, which it's not just the physicians that are overwhelmed or the mid-level practitioners that are overwhelmed. It's really all the administrative workers around the practice that are really also struggling, because doctors will push themselves. They're like, okay, if I used to see 45 patients a day, I now need to see 55 patients
Right.
a day in order to generate the same amount of revenue, because obviously we know third party payers are
Yep.
paying less.
Reimbursements are going down, so I got to see more people just to make the same money. Yep.
Yep. And doctors will do that. They know,
Yep.
I mean, that they're hard workers at heart. They love patient care. They love doing what they do. But there is a trickle down effect to the rest of everyone else that works within that practice or within
True.
that hospital setting. And so, he or she may be willing to put in those extra hours, but in the end, they still have a 40-hour work week for the rest of their administrative team. And their administrative team is just getting so overwhelmed,
Yeah.
burnt out, and wanting to leave. And we're still seeing over the next 5 years, we'll see an additional 23% of people in clerical and administrative positions within the hospital setting or medical practice setting leave the industry.
Wow.
And so with that, that's where we really come in. And so where do we fit in? Well, I kind of describe it as we're like three legs of a stool, right? And
Mhm.
so the first leg is everything and anything front desk related. We can do it remotely, remote front desk. So patient triage, phone calls, scheduling appointments, canceling appointments, full new patient intakes, everything on that front end we're able to do. Referrals, you name it. Then another leg of the stool is insurance verifications, prior authorizations. This is the heavy, heavy lifting that 65% of what we do is that alone, because that's bogging down the practice, either the nurses or medical assistants or someone else in the practice.
Yeah.
And then there's the back office revenue cycle management, everything within RCM, billing, invoicing, following up on denied claims, resubmittal of claims, following up on patient balances, all of those things that happen within that revenue cycle management piece. So there's hundreds of other tasks that we do: fax review, data entry, following up on everything that's put into the EHR or EMR. So there's a lot of other things, but that's the easiest way to kind of dissect it, is just three major legs of a stool.
That's good. Yeah, appreciate that. So talked about, some of the benefits you've seen from the clients. Obviously, I think there's going to be something tied to cost, that I think is an obvious one that people would want to know about, but maybe list out some of the best things that have come out of this service for your clients.
Yeah. Oh my gosh. Retention of their own team. I would say that's probably the number one.
Yeah.
Morale of their own team is going up because they're being supported by additional team members that really can do the work and help to get some of the workload done. And there's so much of it that needs to get done. So I would say that's probably the number one thing I
Yeah.
would say. Secondly is the turnaround and timing of either seeing patients, backfilling open appointments that just went with someone that canceled appointment, but backfilling it quickly because the
Oh yeah.
team isn't overwhelmed anymore. They now have additional staff to kind of help with those. And also just the patients really feeling as though when they call, they immediately get to talk to a live person.
Yeah.
When they come in for their first appointment, if it's with a specialist, for example, they already will know what their benefit plan will cover or not cover. They have an understanding of what the potential, moving forward, what their diagnostic treatment plan will look like, what their treatment plan will look like already, because we've already done some of the front end work of the insurance verifications and having an understanding of what their benefit coverage would look like. So it's really more of also like white glove service.
Yeah.
Patients have more of a white glove service that's available to them because the practice that they're going to isn't understaffed.
Love that. I love that your first answer was morale of staff and just retention. That's critical. That's one I didn't even think about, but it's so obvious in a scenario like this. So that was great.
Time and time again, that's typically one of the very first feedback that we get within the first year of servicing a new client. That's one of the very first things that they immediately start saying, "Oh my God, we can't imagine doing this without you guys now. We
Yeah.
can't, like everyone is so much people that were on the initial calls to get us onboarded, were frowning. I mean, they were really overwhelmed, not happy staff members. And then on the flip side of that, by the end of fully onboarding us, I mean, you can see the weight lifted off their shoulders in
That's
terms of,
amazing.
wow, okay, we really have this under control.
Love that. Let's talk about, the types of clients. Your website talks about, you support all specialties.
Yes.
But maybe talk about that. Are there certain ones that see more of a need? You talked about
Sure.
hospitals. Are you doing hospitals, health systems, clinics? Maybe share kind of the broad range of your clientele.
Yeah, I mean, and we have a very broad range of our clientele. We have the very small practice that's, Midwestern small podiatry practice with one physician that needed an additional virtual assistant or two virtual assistants, to a massive hospital system on the West Coast that started with 5 virtual assistants and within 4 months had 75
Yeah.
and growing. So, and it's just a wide variety. It really is a matter of what is the pain point that they're really having that they need us to fulfill and help with. And that varies. So each specialty, each practice has its own pain points. And that's typically how that very first conversation happens when they reach out to us or we reach out to them. And that very first question and first half an hour of the time we spend is, where are the pain points of where we think we can make an immediate impact? And that's what we target and go after first. So, for example, there's a hospital system that we were onboarded last year. Their pain point was they saw a massive loss in revenue based on patients that weren't showing up to appointments.
Oh, wow.
Right. So, yes, their EMR is amazing. It sends out those reminders, a text
Right.
message, right, saying just a reminder. We all get them now, right? We all
Yep.
get those text messages. We know we have an appointment. But there's a certain number of patients that still don't respond. So we don't know if they're showing up to that
Yeah.
patient appointment or not. This one particular hospital was seeing a $6 million loss in revenue quarterly of patients just not showing up for those appointments.
Wow.
So they onboarded us just to do follow up of the text messages that were never responded to. So just do that. Follow up. Are they coming or are they not? If they're not coming, we can open up that slot immediately to another patient and backfill with wait list or backfill with other patients that we can get them in immediately. And so they saw an immediate change in less than 5 weeks and saw a massive number added to their bottom line,
That's awesome.
just based off of backfilling those appointments. So that's just one example, Jeremy. Then we've got some simple things like patients have a complex new patient intake for complex specialties. We're talking about, not just going to your doctor, your primary care doctor. We're talking about complex specialties. And so they need to have a one-on-one with someone to do their full medical history. We can do that. So then we're backfilling or filling in that need to do that, to take that off the receptionist or take that off the medical assistant. So there's so many ways and so many different practices, and how we kind of fit in. And it's customized.
Yeah.
It's customized to what they need. It's not, oh, come to us, outsource it. No. We're going to come into you. We're going to do it your way. We're going to utilize your tools, and we're going to create and kind of fulfill that pain point and fill that need.
I think that's I love you called it the in-source. I think that is such a great term. So let's talk about, there's times where people have hesitancies to work with, virtual assistants, or really, especially I see it a lot in the billing industry, but when you have, people staffed overseas, there's always a concern like compliance, that's our specialty, compliance, right?
Yes.
How do we ensure that? And obviously I know you've got some things in place. So maybe talk about how you ensure compliance with HIPAA, other regulations, etc.
Yeah, absolutely. So one of the very first things, of course, which is low hanging fruit, everybody has to be HIPAA trained, right? I mean, that's day one. If you can't pass HIPAA training, you can't possibly work in patient care.
Yeah.
So that's day one, right? But even to take a much step further, of course, if that's a people problem. But when you're talking about, working with teams remotely, you have to ensure that devices and connectivity is secure.
Yep.
And so that's where we've really invested heavily to ensure that we're protecting not only patient information, but we're also protecting the EMRs of our clients.
Mm-hmm.
So we added an additional security software to all of our virtual assistants computers to ensure that we would immediately be able to detect if someone was logging in the morning, they had a virus on their computer, or they had some other nefarious actor that something was showing up. It won't even allow them to then move forward to then log into our clients' tools.
That's great.
And so it's things like that make such a big difference. And that's typically the biggest hurdle we have to get over when we're talking to a hospital system's IT team.
Yep.
They're like, no way, anyone, no.
No
Wait
one can
a minute.
access this. Yep. Which is smart on their part. It's the right questions that
It
they're
is
asking.
it is the right it is the right approach, the right, I mean, it is amazing how hackers and what's happening
I know.
in the digital space, how easy it is now, or it seems easy, but there are nefarious actors out there in all places of the world that are really trying to access hospitals, medical practices, banks, you name it, here
Yep.
and targeting the United States for it. And so we all need to be super careful and make sure that we're putting the proper barriers and boundaries in place to ensure that we're protecting the patient information, and we're also protecting the EMR of the client. And so that's been a really a big exciting investment for us as an organization, just to make sure we're doing that.
Great. Okay, we're coming up on our time, Beth. I want
Sure.
to give you a chance for those that are interested. That are like, all right, maybe they've thought about this for a while but been hesitant, or maybe they're thinking about it now for the first time. Of maybe we need to look into this service. Best way to connect with you and your team.
Yeah. The best way to connect would go directly to our website, gmva.com, or globalmedicalvirtualassistance.com. There's all sorts of information
Yeah.
there. There's videos of who we are, what we sound like, what our virtual assistants look like, you name it, it's all there. So you can kind of get over some of those mind blocks that we all kind of put in place when we think of remote
Right.
care and remote staffing. And then beyond that, there's a whole source of resources there. And then you can also click to have a strategy session with one of our nurses that's on staff that can talk about strategizing how we can make an impact, how we can get onboarded into your practice. And also, they're not salespeople. They come across and really are clinical care people that understanding of how to use medical virtual assistants in a practice.
Yeah.
So it's not a hard sale. It's nothing like that. They really are coming from a place of the clinical mindset. So you can go ahead and set up that strategy session right from our website.
Perfect. Beth, thank you so much. This is really, really neat. Congratulations on your success, and congratulations on what you've been able to do to help clients all across the healthcare spectrum to find a solution that can drive some results for them.
Yeah, thank you. And I'm just so proud to be in healthcare. It's an amazing place to be for me.
Absolutely. All right. Take care, Beth. Thank you.
Thank you.
Thank you for tuning in to this episode of the Healthcare Connections podcast. For more information on the topic we covered today, you can reach out to me or to our guest. For any additional information on healthcare compliance pros, feel free to email me at jwin@hcp.md. Don't forget to tune in next week. Thank you.